with us. Dr. Vaglia from IRMC, and also from IRMC, Dr. Robin Rodriguez, who was one of the new residents, right?
Yes, that's correct.
Very good to meet you all, and thanks for coming in to visit with us. I call this my TikTok segment, thinking I'm really, really clever in saying that. Tom, you know I'm not clever.
Oh, no, yes, you are.
Tom, we've talked about ticks before. You're a recognized tick expert, but we're hearing, of course, that, by the way, our conversation brought to you by Marcus and Mack. I have to get that in. Voted best personal injury law firm in the Best of Indiana County contest. Marcus and Mack, a law firm representing injured people. The ticks we're hearing are much more plentiful this year because of the mild winter. Is that true?
Well, it's probably not so much the mild winter. The ticks are well adapted for our winters. They do perfectly fine in Minnesota. Mm-hmm. However, it's been warmer earlier, so the ticks have been out. I checked there's actually a tick bite data tracker on the Center for Disease Control website, and I checked it this morning and saw that at least emergency room visits for tick bites in the Northeast started like in January.
There are a number of different websites and organizations that are quite concerned about ticks, and you mentioned one a couple of moments ago as well.
The Centers for Disease Control.
Yeah,
has pretty good. It has very good information. Yes.
Yeah, but off mic, you mentioned there's one run by one of our universities in the state system.
Oh yes. So if you're bitten by a tick and you would like to know, or you're curious to know whether it is infected with either the Lyme disease agent or another tick-borne disease agent, you can send it off to www.ticklab.org at East Stroudsburg University. Mm-hmm. And they will test it for the Lyme disease agent and other agents. Yeah. And it's very easy. Just pull it out, try to get the whole tick, not just the head.
Sure.
Or just try to get the whole tick. And then you Ziploc bag and go to the site, log in. They'll give you a number and a form, send it in. And they'll let you know they have it, they'll acknowledge the receipt of the tick and test it and send the results.
But you mentioned that we talked not just about Lyme disease, which is very, very serious, but there are some other diseases that could be carried by ticks as well. Kind of rare, but still they are out there.
Yes, anaplasmosis, bacterial disease, and babesiosis, a protozoan disease. And babesiosis has gotten a lot of press. I've seen recently. Mm-hmm. About on the rise, and have some other people that could maybe confirm that or not.
Dr. Vaglia, Dr. Rodriguez, it's time for you to weigh in on this as well. Dr. Vaglia, I know that at IRMC you're quite concerned when someone shows up with the tick because that could be the potential to start a chain of medical events that nobody wants.
Absolutely. And one of the first things that patients need to know is to really recognize the ticks and to be looking for them and to do a thorough search, particularly if they've been outside. And so particularly out in the woods, out in the grass, in the yards, or if their pets have been out in the grass or in the yards, to take a look at their pets as well. And to watch out for those ticks going out into your daily activities outdoors, perhaps using some permethrin spray on your clothes to make sure that when the ticks land on your clothing, that they die and that they don't become attached to your skin.
Mm-hmm. Dr. Rodriguez, let's ask you about if somebody has suffered a tick bite, has maybe a tick embedded in them, what should they be doing? What are the first steps that they should take? Come on over closer to the mic there.
They're always welcome to come in to the office where we can actually remove the tick. And the tick actually can be sent, as Dr. Simmons said, for identification as well. Additionally, if we can identify it as an Ixodes tick, which is the common carrier of the Lyme disease vector, we can actually give a prophylactic dose of antibiotics as well for them.
Mm-hmm. Are antibiotics the general first step in treatment?
Yes, because the Lyme disease vector is a tick, but the actual cause of Lyme disease is a bacteria known as Borrelia burgdorferi. It's a spirochete type bacteria, which means it's shaped like a spiral. Mm-hmm. So as it's a bacteria, antibiotics are the management for bacteria.
Some folks will try to remove the tick themselves. Advisable or no?
Certainly they can give it a try. They're a nice little tool called a tick key that you can keep on your keychain or at your house. that nicely lifts the tick out. And if you catch it earlier before it gets deeply embedded, that's pretty easy to do. Once they become more deeply embedded, it becomes more difficult. And I think that a lot of folks get really worried when they hear the term Lyme. They hear about all of the more advanced symptoms of Lyme and become quite worried and feel as though the situation is emergent. We do have antibiotics that treat Lyme very well, and as long as they come in to see their primary doctor, within the next day or two, we can certainly get them treatment and prophylactic treatment so that they don't develop the sequela that they're concerned about.
Eventually, you get over whatever it is that the symptoms are, and you feel better, and you get on. Is there the chance that Lyme disease remains within you, as some diseases do, and will come back on you later in life?
If someone comes in early and recognizes the tick bite and gets early treatment, they should have no long-term sequela. There are some changes that happen in the body, just like, we've seen all kinds of interesting changes that the COVID virus can do to a body. And all infections have the potential to do different, I don't want to say, they have effects on the body that we might not necessarily predict up front. And so, we can watch for all those, but early recognition, early treatment is definitely the best way to go.
Yeah. Tom, there's a famous episode of Last Man Standing where Ed Elzonte, played by Hector Elizondo, is talking about the tick being nature's perfect warrior. And Tim Allen says something along the lines of, well, the perfect warrior can be just beaten by pulling up your socks. Prevention of tick bites and of contact with ticks, I know it's very big and it is something that is desirable. Sometimes you just can't, though.
Yeah, as in many illnesses, prevention. It's all about prevention, and particularly for ticks. So preventing a tick bite is the best way. So taking precautions when you're out, not just hiking, but working around the yard. Most cases of Lyme disease are working around the yard, doing yard work, especially if you're on the edge of woods or in the woods. So whenever I go out, excuse me. So whenever I go out, I basically think tuck, tuck, tuck. So I wear light-colored clothing, tuck my shirt into my pants into my socks. I do use permethrin. It's very, very effective. Let's hope it remains very, very effective. And it isn't just a repellent, but it actually is it actually kills the ticks.
Yeah.
And then when you come in, I throw my clothes in a dryer for 10 minutes, quick spin, hot. That heat just kills them very quickly. And take a shower later in the day and check all my parts to make sure I don't have a embedded tick.
The possibilities of your pet, your dog especially, transferring that tick to you.
Yeah, if you have a pets are very good at, I go out and we go to all this trouble of dragging cloth through the woods to collect ticks. If I had a dog, I'm not. They would do probably a better job.
Just have them
But,
shake.
yeah, exactly. So they'll pick up ticks, and if that tick isn't well embedded and it falls off, if it sleeps with you on a couch or whatever, sharing your personal space as many pets do, the tick could, it's going to try to get back on a host, and it may be you rather than a dog.
Yeah. Indiana County, of course, was recognized a few years ago as being one of the real hotbeds for tick infestation. Is it still? Is it worse here than it is other places? Or basically every place is a risk, isn't it?
Yes. In the Northeast, if you're in woods like locally here, White's Woods or Yellow Creek State Park, the ticks really like that hardwood closed canopy, nice and moist and cool type environment with leaf litter, and that's pretty much everywhere. And so are the ticks. So we have a very high density of ticks, but that's pretty much the same now for all of Western Pennsylvania.
Yeah.
And it's important to realize that it's not. It could be urban, rural, or in between.
Sure.
Even in parks.
Dr. Rodriguez, you mentioned a couple of moments ago to come to the office and get that tick taken out. Are we talking, I know IRMC Urgicare at Chestnut Ridge is a great place, the walk-in clinic as well. Are there other doctor's offices or all of them equipped?
Pretty much all of the offices should be equipped, but I was talking in particular our office in Mahoning Medical Center. Dr. Vaglia, our program director, has been very inclined to teaching us residents about the significance of Lyme disease and being able to note it in patients. So we are very well equipped to handle that as resident family medicine physicians. And as Dr. Simmons mentioned, we do have a high rate of Lyme disease and tick-borne infections in Indiana County. Per statistics, in Pennsylvania, per out of 100,000 population, Indiana County has 128.3, whereas in Pennsylvania as a state, it's 58.4 per 100,000. So as you can see by our statistics, Indiana County has an elevated rate of potential Lyme disease. So it's very, very important to get the word out about checking yourself, as Dr. Vaglia mentioned, making sure you check your animals, as Dr. Simmons mentioned, and just getting in if you feel that you had a tick bite or you see a tick on yourself.
Yeah, and that Mahoning Medical Center in Marion Center, that's rural. We're rural here in Indiana, but that's really rural, meaning that, you're right there in Marion Center, but it's surrounded, the whole area, by a lot of rural settings, and so folks are outdoors a lot. There's a very large Amish population in that neighborhood, and they would be susceptible as well. So, Dr. Vaglia, that's, people need to pay attention, don't they?
That's definitely true. And Pennsylvania is the leader nationally for the number of Lyme cases. And so, we certainly need to keep that in mind as Pennsylvanians. Another thing that we need to think about is when our kiddos come in is to check them head to toe, get off the clothes they had on outside, get them in the tub, and check. Ticks are sneaky. They like to hide in creases. They like to hide behind the ears and in the groin area. So it's important that our kiddos check all over their body, and for the tiny ones that we check them out as well. Another thing to keep in mind, we have a lot of outdoorsmen around here, outdoors women, and when we go out and go hunting in the off season, we think about June, July as the peak tick season. But for those of us who are out in the woods in the fall, and whenever we get those deer, they often have a lot of ticks on them. And so our hunting friends need to keep in mind that we also are at high risk. And an interesting thing about the permethrin spray, if you spray down your outdoor hiking clothes or your outdoor hunting clothes, that spray lasts for multiple washings even. And so if everyone, before they go out in their hunting season or their hiking season, spray down their regular clothing that they wear for those activities, it lasts for quite a while, and so they can be protected.
I would add that there's, I guess I like websites, but insectshield.com, you can send your clothes to them. That's what I do for our research clothes that we use. And they will really factory impregnate those clothes with permethrin. And it's not that expensive. So you can take your favorite gardening clothes or your hiking clothes, do it every year, and send it in. You pay the postage, and they'll treat it and send it back.
Oh, cool. Yeah, and it's a great cologne, too.
There you go.
Thanks so much, Dr. Tom Simmons, Dr. Amanda Vaglia, and Dr. Robin Rodriguez for coming to visit with us. We appreciate it.
Thank you.
Oh, thanks. My pleasure.
It is the voice of Indiana County, WCCS, 101.1 FM and AM 1160. Fox News is coming next at the top of the hour. Josh Whittison is in the WCCS newsroom right after that.